I'd like to welcome all our viewers and listeners here on Amakhosikazi Media. This is the program Women's Voices in a Time of COVID-19. And today I've invited women that work in the development sector with different communities to find out how the virus has impacted their work and the communities in which they work. I have with me here on Zoom, Melissa Nomakosindlovu and Talenti Chibovu. I hope I pronounced your surname properly, Talent. You'll correct me as you introduce yourself. We also expect to be joined by Nango Southwestern Region Coordinator Sharon Stolle later. But for now, Melissa, may you please just unpack for us your title, your job title, where you work, and the kind of work that you do in the communities as an organization.
I'm Melissa Nomakosindlovu. You said it out correctly. And I work for Mtonjeni Women's Forum. As Women's Forum, we are an organization that is into preventive and responsive measures to gender-based violence. So by preventive, I mean that we educate communities, we engage companies to strengthen their policies or GBV. We also engage Parliament towards strengthening of legal frameworks that deal with issues of sexual harassment, GBV, etc. And by responsive measures, we assist women with what we call court support services. So when women encounter violence, we assist them to fill in papers that are needed in court. And we also provide counseling services where we assist women make informed decisions about their situations before they either decide to go to court or take any form of action about their plight. We have what we call rehabilitative counseling for men, because we only deal with women as our clients, but we also deal with men and rehabilitating them to realize the folly of their actions. So we kind of have this whole realize their actions, assist women make meaningful decisions, and all. Yes. So in short, that's who we are.
Thank you, Melissa. Talent, may you share with us the kind of work that you do?
Okay, hello everyone. Talent Chibongoze. Can you hear me?
Yes, I can hear you.
All right, this is Talent Chibongoze. I'm from the Southwestern Region Gender Network, which is a regional gender-focused network which strives for a just society where women, boys, girls, and men enjoy their freedoms and rights. Basically, we are involved in programs that aim to enhance the rights of women, looking at issues to do with gender-based violence under the Spotlight Initiative, where we are looking at trying to eliminate gender-based violence and harmful practices against women and girls in Matobo, Umzingwane, and Bulilima. We're also involved in activities that enhance citizen participation, focusing mainly on women and decision-making and policy-making, so that they also participate in everything that affects them. We also look at issues to do with access to sexual and reproductive health rights. So basically, that is what we do. Thank you.
Thank you very much, ladies. Maybe if I could start off with how the virus has impacted the communities in which you work. Talent, maybe I'll start with you. How has COVID hit those areas that you have been mentioning that you work in? Because I notice a lot of them are in remote areas, quite far from where your offices are based.
Mm-hmm. So with especially the COVID-19 restrictive measures, which have been somehow restricting our access to the communities and the numbers of people that we would really want to reach, it's been really tough on communities, especially the women and girls, as you know, that in times of emergencies such as COVID-19, the COVID-19 pandemic, you realize that women and girls are the most vulnerable because some of the services that they may need to access, they may not be able to access these due to movement restrictions. Some of them may need to have access to courts. They've not been able to move around to access those, to have their cases taken if maybe it's GBV cases. And some of them, they live in one of the most remotest areas. Take, for example, Bolilima. They don't even have access to information, not even to talk of WhatsApp or Econet lines that will give them information on text messages or whatever. The network that they use is from Botswana. So you don't really have access to such communities to give them information about gender-based violence. And you also don't have means to go and engage with them, seeing that COVID-19 has restricted how we interact with communities. So it has been really a big challenge. And they don't have access to such platforms as Zoom or WhatsApp platforms. So it's been really tough to get to give information to those communities and for them to access information or even to access services, gender-based violence services, support services, I mean.
Melissa, has the situation been the same in the communities that you work in?
I think the situation has been cross-cutting because you'll notice that, Vusi, when government was stating which particular people or players within different industries are essential services, GBV workers or those providing GBV services were not prioritized, aside from the courts and the police. But for the police, you'll notice that most of them were monitoring issues of lockdown regulations and to GBV. And most hospitals were in panic mode and looking at COVID and prioritizing COVID. So if you go there with a GBV case, it wasn't as important as dealing with issues of COVID and ensuring that everybody does not get COVID. But other issues, I think, just to add on to what the lady was saying, is that there were travel restrictions. So there was no transport. You'd have a woman who is emakhaya in Cholocho having complications and she has to go to the hospital or travel to hospital. A lot of women, I think there were about 3 cases that we had of women in Umzingwane, a case in Cholocho, and I don't remember where the other case was, where women gave birth on the way. And the case of Umzingwane, the husband actually assisted the woman give birth because they could not find any transport. And if there were any transporters, they were inflating prices because they were not allowed to be mobile. So there were challenges like that. And there are also challenges of people who have experienced rape in remote areas. If there is no post-exposure prophylaxis within the nearest clinic, you have to travel and you have to get the assistance within 72 hours. So because those things were not prioritized or looked into, you had women suffering on one end. And like she said, there was an escalation of GBV cases, not as bad as the first lockdown, but they were there. There is the Trinense case where a woman was killed brutally by her boyfriend. The case of the student from Polytechnic who was beaten by her boyfriend as well and murdered in cold blood. These are cases that were happening during the lockdown because when you find yourself confined with your partner, Busi, you are not used to talking about these issues and resolving them amicably. And under normal circumstances, if you got angry or upset, you could just move out of the house and go and see a friend or something. But in this case, because you're locked in together and there are many other factors such as economic factors, etc., you end up beating each other. And there's this violent eruption of conflict. And another thing, Bosi, women are engaged in most of income generating activities that are within the informal sector. And parents who are single and taking care of the family, or women who predominantly are in the informal sector, who have been providing for the family, could not provide for a month plus. So you can imagine when you all the money that you have, your capital, borrowing money, and at the end of the day, because everybody else has the same plight, you have nowhere to borrow. So we had the plight of feeding our families and providing for our families during the lockdown. And this really became a challenge because of the regulations that were in place. So in short, I think those are the major issues or the highlights of what women went through and the challenges they experienced.
And as an organization, how did that compound your challenges as well in reaching out to these communities and trying to adjust your programming to be able to assist them? Because these are added problems to already existing challenges in these communities, Melissa.
You know, there are some places where they said that they wanted humanitarian organizations that were responding specifically to COVID-19. And in some areas, we were able to assist by giving out dignity kits, because you realize, we see that at a time of COVID, we'll prioritize food, we'll prioritize taking care of the family, we'll prioritize health, but issues that protect the dignity of a woman are not prioritized. Things like access to pads, access to water and sanitation. And there was a shortage of water, as you'd realize. So because these issues were not prioritized, we're able to go out and say, let's talk to women about COVID-19. Let's distribute dignity kits to women, but also let's make sure that women know where to go when they encounter GBV during the time of lockdown. We were also able to, for those who have access to social media like WhatsApp, we're able to generate messages, posters, and animation videos to actually go out there and speak to women's situations, speak to the realities of what women go through, but also let women know that regardless of the lockdown, they're still able to get access to support. And we'll also provide a free number so that women can be able to reach us and speak support, because sometimes you need psychosocial support in terms of decision about your situation, or realize that the situation you're in is potentially abusive. So we were able to provide our toll-free number to women out there so that they could access us and also get support during this time. So that is the best we could do, because our movements were also restricted, and other districts were very clear that we could not go in and access communities. So the best we could do is use radio, animation, social media, and our toll-free number.
And in cases of abuse where someone is arrested, they need to appear in the courts, was the justice system as efficient for victims? And were you able to remove them out of these abusive situations? Because if you are locked down and it's the only place you can be, what happens to a victim when they are stuck with their perpetrator? If they cannot get to the police, they cannot get to the courts, what were you doing in such situations?
Tough times call for tough decisions. And the nice thing is that we were able to work with the police. This is as well as Bulawayo, to say these are the situation we're in. The nice thing is that they were able to attend to urgent applications, and protection orders are part of the urgent applications when you're able to respond to some of the cases where there were cases where we could not travel. We were able to engage the police and follow up on some of the cases that were happening, the police, you're able to also follow up on the cases to say, how far have you gone in addressing these cases? In the cases of extraction of women from where they were staying in abusive tests, unfortunately, we were incapacitated to do that, and we referred some of the cases to that we had to our partner organizations. Like we believe in family networks and social safety within the family. Unless it is a case that is extreme, that the person does not have any family members who are local that they can go to. But in instances where they can go to other family members, we actually suggest that you move from where you are or in a place of danger to actually one of the family members. Yeah.
Mm-hmm. And Talent, you'll notice that the corona hit when already in places like Bulawayo and indeed in Matabeleland South, water issues are already a problem. And COVID actually requires a lot of water availability for the washing of hands, sanitizing of basic utilities. How, as an organization, were you meeting such needs for communities and women that are already suffering from needing to supply these basic needs to their families and are struggling because of poor service deliveries? And now, so with COVID, it becomes worse, and yet they are not allowed to mingle, they are not allowed to go where there are crowded places. How do you keep the message alive? Your basic message alive for the women while also trying to protect them against the COVID virus?
Thank you for that. In lockdown, there was not really much we could do in terms of the City Council to somehow respond to some of the community questions that were coming from women and girls regarding water challenges. And we also engaged some community-based organizations which would speak on behalf of the communities on water challenges. For example, that issue of typhoid that happened in Luveve, we had a radio program on that. And we also engaged the BCCs to respond to the question. That was basically all we could do in terms of the challenges in Bulawayo.
And now that this virus hit and exposed a lot of inadequacies in terms of service delivery, maybe can you point out to us some of the things that you realized were really lacking in communities that before the virus hit were not prominent?
Well, I will take, for example, rural communities. Say before the COVID-19 lockdown, we mostly didn't realize the instrumental role of community-based organizations as well as some community structures in terms of responding to certain community needs as well as gender-based violence. So when the lockdown came in, we had, of course, trained some people in communities on how they can handle gender-based violence, although we didn't really have a picture of how things were going to work out. But when the lockdown came, we realized that such structures are very instrumental in responding to certain community problems, as well as dealing with certain community problems at a community level. I'll give you this example that around March there, we trained some community-based, gender-based violence activists, and we also trained some around June, July last year. So before the coming in of the lockdown, those structures were not really working. But when the lockdown came in, those were the same people that we were getting information from. Those were the same people that were being instrumental in responding to cases of gender-based violence. For example, we had a child, you realize that after the closing of schools, many children were spending most of the times at home, and mostly in the rural areas, some parents felt like this child is spending too much time at home when they could be getting married and would be earning something. So there was a child who was forced into marriage. That child was supposed to be in Form 4, but she was forced to get married. But with the help of the community structures that we had put in place, the marriage was stopped when the bride price had already been paid and a cow had already been slaughtered for her wedding. So we used these community structures to respond to such a case, and they also engaged the Ministry of Women Affairs to stop that marriage.
So in a way, are you saying that this was a test of your sustainability measures as organizations, how far you go into empowering communities to self-sustain, even when you guys have left the community or are unable to reach them at the time?
Yes, that's very true. These are the same structures that are going to keep on spreading the word of anti-gender-based violence, anti-harmful practices in the communities. Even when the programs end, the communities should be able to respond to such cases on their own.
Wonderful. At this point, I'd like to welcome Sharon Stole. I noticed she has joined us. Sharon, can you give me a sign that you can hear me? And then we can continue with the discussion. Melissa, do you find that? Hello, Sharon.
Hello. Hi, Busi.
Wonderful.
Thank you for inviting me. I'm sorry I had to join you late at another meeting.
No problem.
Sorry
Thank you so much. No
I'm
problem.
still trying to. I'm still trying to catch up.
Okay, no problem, no problem.
Okay.
So, Melissa, I was going to come through and say your organizational structures in the communities, have they been able to take up the mantle of running with your message and the work that you have taught them so far, as Talent has articulated?
With our structures, we have GBV response, and we also have structures that deal with advocacy. But with structures that deal with GBV response, we have what we call community-based counselors that are there in Siza and Mzingwane, and what we call male champions. And these have specifically focused on responding to GBV and also prevention through positive messaging. And like Talent said, I think these have been quite instrumental in terms of doing environmental scans on people who come into the community with COVID-19. And they've also been instrumental in providing referrals for people who have encountered gender-based violence within their communities. So they have been really central towards assisting victims of GBV within their communities, and also the response mechanisms thereof. And for me, really, in Cholocho, where we are doing governance, the women have been doing a lot of advocacy actions. You'll notice that they raise issues of their children across the borders accessing ARVs during this time, because most of them feel they should get ARVs from Zimbabwe. They raised those critical questions to hold duty bearers accountable. Issues of building of clinics. I noticed that the Cholocho RDC through the devolution funds have actually proceeded to finish off some of the clinics that the advocacy action teams were campaigning that should be built, or infrastructure should be put in place to cover women, their maternal health needs, sexual reproductive health needs, etc. So for me, the structures are really a key sustainability factor in terms of ensuring that things are there and things are in place, but also during times of crisis, they've really proved to be a worthwhile mechanism towards programming in any community. Yeah.
Yeah, Sharon, if I could come to you, maybe if you can unpack for those watching or listening, the kind of work that NGO does within the community, especially during this time of COVID-19.
Hello.
I can hear you, Sharon.
You can hear me. Okay.
Yeah.
Let's see. Okay, NGO does not work directly. As Yahweh, we do not work directly with communities. We work. We mobilize, or rather, we work with communities through our members, the CSOs, who are our members. So in terms of mobilization, community structures and so forth, we're really not directly involved, but we've been working with members who are on the ground. We have really been helping us access members, access communities, mostly through online platforms, because it has been very difficult to go to these communities.
Indeed, I would like to know how you have been supporting these institutions, because from my discussion with Talent and Melissa, there have been a lot of challenges that have cropped up because of the restriction of movement, the unexpected hiccups that communities are facing, besides the already problematic situation that they were already living with. So as an institution, what are some of these issues that you're helping organizations maneuver around to overcome?
Okay, that's a bit of a difficult one. But what we have been doing has been, we've been getting clearance letters for our members, especially those who have paid up members. We have been finding it difficult to access communities because they didn't have clearance letters. So that has been done. And it's been quite a success, because previously some organizations were not able to go to places like Emakaya, but because of these letters, they've been able to sort of continue to interface with the communities. And then we have also been engaging donors to try and lobby them, or to advocate that they become a bit more flexible in terms of the contractual obligations that CSOs have, where there could be no cost extensions to certain programs, because a lot of our members were not able, for example, to spend. The burn rate rather was reduced. So a lot of members were not able to finish their money within the stipulated times. So I think those two are the ones that I can sort of think of right now.
Mm-hmm. And would you say that directly organizations have also been impacted by COVID-19 in terms of contracting the virus, workers not being able to go into communities, or when they catch the virus, do they have support from organizations in terms of treatment, seeing as a lot of NGOs do not support medical aid and things like that?
Do you know something very funny is that it hasn't been easy for NGO to get statistics, for example, on who has been sick, on whose staff members have contracted COVID. But I'll also tell you there are a number of cases that I've heard where people, they contracted COVID and we were working from home, remember? Mm-hmm. Some people would contract COVID, maybe stop going to the office, they get through the COVID on their own. They never really come back to the office to say, look, this is what I was going through. And also, organizations haven't really been open about how their staff has been affected, or how many of the staff has been affected. So that's a bit difficult to say, but definitely we've even lost quite prominent or well-known activists and CSOs staff. We've lost them to COVID, which is, I think, a testimony that we have really been affected as a sector, as the CSO, the NGO sector.
So would you say,
and also remember that.
Go ahead.
Oh, I can only say, remember that, like you spoke of the restrictions that had to come up as a way of responding to the COVID-19. I think we really found ourselves having to do more online engagements, interactions, and the challenge was, for a lot of people, especially in the first few months, it was really difficult to get a lot of people on these platforms, mainly because people were not technologically savvy, or we were still learning on how to use these platforms like the Zoom platforms. Then also you realize that when you have a big meetings, or where you have the meetings where a lot of people participate, you'll get a lot of people who are very quiet, which for me has meant a number of things. It may mean that someone just logs on, they don't say anything, or they are busy with other things, but they've logged on. So you think you have 30 people in a meeting, yet maybe you're only 5 or 6. Then secondly, that there's a challenge when it comes to the use of our online platforms. Some people may want to contribute, and in some cases, we have also noticed that some people may not even know where to mute or to unmute. They don't know where to write their comments, or they feel that I think there's so many challenges when we're using these platforms, where you find that you sometimes get less interactions or less contributions from people, because we are still scared of using these platforms. Maybe you and I may not be, but there are many other stakeholders who are not able to contribute as much as they would have had it been for physical, one-on-one meetings with them.
Okay, are there any efforts that as a network you are making to support, as you said, a lot of activists have been lost to the virus. Some were not even mentioning that they were ill. Maybe to follow up on such, and also maybe to support with PPE and trainings on how to stay safe, as NGOs need to still continue in the communities despite the severe nature of the virus.
I'm not aware of any efforts that NANGO is making, especially NANGO Zimbabwe, the national office. But these are concerns that we have raised as the association, to say we need to fundraise, or we need to mobilize resources and for PPEs for our members, and also training on how to, on this new way of doing business, because it's one thing also to get PPEs, to distribute PPEs, but then it's another to use them and to follow a protocol. But then again, when it comes to COVID, what we've been doing has been, we've been sharing a lot of information that has been coming from the government, of the regulations, the new regulations that the government came up with on COVID-19, the messaging that the Ministry of Health came up with. We tried to share that, to spread that information to all members, to all CBOs and CSOs.
As we wrap up, maybe if I could come to you, Talent, would you say there is any silver lining to this? Have anything good come from this COVID-19 wake-up call for you as a development worker, as communities, on things that maybe before this you didn't realize that have come to light that you need to work on moving forward?
Of course, it's been a bad thing having the pandemic, but there is a silver lining, like you are saying, because somehow it has made us realize that we have to embrace technology, like Sharon was saying. We have to somehow move from, in as much as it's important that we go to the communities, especially those that are hard to reach in terms of technology. But for those who can, it will be very effective for us to use platforms like Zoom, like we are doing now. It seems to be a bit cheaper, although somehow we are used to the traditional way of doing things. Like if I don't see this other partner in person, you feel like, was that really a meeting? But we have learned somehow to embrace technology. And this has also helped us as CSOs to say, you don't really have to always travel to Harare. You don't always have to travel to Rwanda and all that. You can use the ready-made, technologically advanced platforms that we can use and save time, save money. So there is a silver lining in this whole thing. And of course, there's also the issue of something that we were not really much emphasizing much on, like the community structures that I alluded to earlier on, to say those are very important structures which will go a long way in terms of sustainability. They will also go a long way in terms of us still being in touch with the communities, even after these programs have are long gone. So yes, there is a bit of a silver lining.
Thank you, Melissa. What would be your answer to that one? Is there any good from this?
I think like she said, Talent said, we are embracing the digital era, and it's seen strengthened coordination amongst different stakeholders, because now we can meet over Zoom. Before that, I don't think we used a lot of Google Teams and Zoom, but now because we have embraced the digital era, they strengthened coordination. There is learning amongst partners on innovative ways of programming and reaching communities using different mediums. And I don't know if it's COVID-19, we'll see, but I've just seen an increased kind of responsiveness by state actors. The police, the local government structures, the ministers are now coming forward and willing to engage with state actors, because not only because of the disaster, but they've seen that together we can coordinate our actions, work together, and assist communities. So I've just seen a strengthened coordination amongst different people, responsiveness, and people really embracing the digital era. So much that if another disaster then comes, or not that I'm anticipating one, but we now have a more coordinated way of responding to it. But on the other hand, I feel that there's still a lot of considerations that government needs to make, like prioritizing issues of GBV response and prevention during any disaster or any pandemic. And also ensuring that civic actors towards responding and preventing to some of these issues. Another gap that I noticed is that people do not have clear figures when it comes to GBV. I think like Sharon was saying, that there are no clear figures of how many people in civil society were affected by COVID. It actually shows a gap in terms of how we are coordinating with each other, how we are responding to the pandemic, and also brings about another gap to say that if we are to make credible responses, how effective are they and how relevant are they to the civic actors themselves before they go out within communities? So issues of data issues of information, issues of knowledge sharing is still a huge gap that we then realized during this time.
Thank you. Sharon, can you close for us on your, maybe what you see as future prospects for the development arena, where NGOs are meant to be planning around in terms of the work moving forward? Melissa and Talent have already painted a picture, a more digital picture that institutions need to get into. What else would you say as we close, NGOs need to be focusing on as we go further into 2021 and we are still on lockdown?
I think Melissa more or less summed it up when she spoke of. I think even with talent, you know, we need to continue to embrace the digital platforms that are there. But I think also as CSOs, we should be looking at empowering our communities or our beneficiaries in terms of ICTs. I know that ordinary women, for example, are very conversant with our WhatsApp platforms for various reasons. But I think when it comes to development issues, we still need to empower the women in both in rural and urban areas anyway, so that they are more literate when it comes to the digital, their digital needs or in the digital world. And then of course, we need to be more coordinated when it comes to this response to pandemics such as this one. And I think we also need to work more on ensuring that there is a gendered response. It's not just a blanket approach to say we are going to be giving so many people cushioning allowance, but to also look at how are the women affected more than the men, and how are we going to make it easier on women, because remember, we're the ones who bear the brunt of the pandemics. The men can continue as if everything is okay. So we need to improve on that, having a gendered response, both as CSOs and also to lobby the government to be more responsive. And also, I think one area that CSOs could look at is to lobby our service providers together with the government, in fact, to improve or to work a bit more, or to put a bit more effort into improving our infrastructure and utilities when it comes to the service provision for our mobile networks, so that it's easier for us to connect, and so that women or people in the remote areas are not left behind in terms of information. For example, right now, there is so much misinformation about COVID. Someone who was say on social media in December is so sure that if they steam for 3 days, is it 3 or 4 days, or if I come across someone who is wears COVID, you'll be fine. But they still think that taking vitamin C, for example, is going to help you. Things have changed. Things are changing so much. So we need to keep these communities informed.
Thank you very much.
For me, those are the 3 points. All right.
Okay, thank you so much, ladies.
It's fine, thank you.
For shedding light on these issues. It's quite interesting when you talk about how communities in the remote areas were most impacted, but also are becoming more responsive to what needs to be done, not only about COVID-19, but about the attached arising issues when the organizations that they've been working with are no longer able to travel to their areas. That for me is very enlightening, and I think is a good thing, and it shows that the work that community organizations are doing is not just for themselves, but indeed for the empowerment of communities. Talent Chibongotse, thank you very much for being here. Melissa Nomakhosi Ndlovu, ngiyabonga kakhulu. Sharon Stole, thank you for taking the time despite your busy schedule with other meetings. Thank you for making us worthy enough for you to show up.
Thank you, Busi.
Thank you for the opportunity.
You're most welcome, and all the best for yourselves as organizations and for the communities that you work with. I hope we'll be able to chat again in the near future. Have a good day.
Thanks, you too. Stay safe.
Thank you. Cheers.